Hello everyone. I hope I'm live now. You can see me, you can hear me. Let me confirm if I'm clearly visible, audible. I will start the class ahead. Let me confirm if I'm clearly visible, audible. Okay, I hope it is working. I'm clearly visible and audible to you people. So welcome you all for today's session. I am Dr. Priyanka here, educator on Unacademy. And today I am here to continue my series in community medicine, which I have started 2 days back. That is epidemiology. So epidemiology is a very difficult topic to understand per se. There are many numericals also which come from this topic in university exams of the pre-final year MBBS as well as in all competitive exams NEET PG, FMG, and NICT. So there is no skip for this topic. We have to cover this topic. We have to understand this topic. So concepts are important. So we have already started it, and before starting it, we have seen what is the difference between rate, ratio, and proportion. So I have told you each of them have a numerator, denominator, numerator, denominator, numerator, and denominator. Right? In just a second. In rate, the numerator is a part of denominator. In proportion also numerator is a part of denominator. But in rate, the multiplier is never 100. It is more than 100. It can be 1000, 10,000, lakh, 10 lakh. In proportion, multiplier is always 100. Always 100. And in ratio, numerator and denominator are not related to each other. They are two random quantities. So looking at any formula, you can divide whether it is a rate, whether it is a ratio, whether it is a proportion. That was the first thing I have taught you in the first lecture, right? Okay. After that, we have started the measurements of mortality and measurements of morbidity. You know the difference between mortality and morbidity, right? So we have completed the measurements of mortality. I guess we have completed the measurements of mortality. So there are 6 measures of mortality. Yes or no? We have completed this. So crude death rate, CDR, specific death rate, SDR, proportional mortality rate, PMR, survival rate, SR, case fatality rate, CFR, and standard mortality rates, SMR. Now in each of these, you should understand the formula of these. The first thing is the formula. You should know the formula of each of these. You should know whether each of these is a rate or ratio or proportion, and you should know some important points regarding this. So we have already covered it, this table. So in crude death rate, we have seen the mid-year population is the denominator. And out of the mid-year population, how many people are dying? That is into 1000. So it is a rate because numerator is a part of denominator and multiplier is 1000. In SDR also, the denominator is mid-year population. But the numerator is number of death dying due to a specific reason. Here number of death, all reason. Here specific reason. That's why it is crude, it is specific. The opposite each other, right? Again, numerator is a part of denominator and multiplier is 1000. So again, it is a rate. So there is a specific, very small difference between crude death rate and specific death rate. We have seen the third thing, proportion mortality rate. Here denominator is not mid-year population. Denominator is total death. Out of total death, how many deaths occur due to specific reason? How many deaths occur due to TB? How many deaths occur due to diabetes? Into 100. So numerator is a part of denominator, but multiplier is not 1000, it is 100. That's why it is proportion, right? The next two we have seen the survival rate and case fatality rate together. In both of them, the denominator is the patient, total patients, total cases. See the denominator. Out of the total patients, just suppose I am having 100 patients of brain cancer, right? 100 patients. So out of the 100 patients, after 5 years, how many are surviving is survival rate, and how many are dying is case fatality rate. So both are reciprocal of each other. You can see. If this is 80%, 80% are surviving. So 20%, obviously 20% are dying after 5 years. So this is a positive indicator. This is a negative indicator. In both of them, the denominator is total patients. And because the multiplier in each of them is 100, that's why both of them is proportion. So you should understand what is rate, what is proportion, in which of the following it is rate, it is proportion. And you should know some important points about each of them, which is the crude, which is the simplest, which is the best, which gives us prognosis of disease, which give us killing power of the disease. So you should know about all these. I hope we have already covered all these. So these were the measures of mortality. Mortality. So I am moving to the third topic now, mortality. Now today I will teach you measures of morbidity, not mortality. I will teach you measures of morbidity. Okay. Give me a minute to move ahead. We have done many questions and polls on this also. So let me start measures of morbidity. After that, I will start the hypothesis and descriptive studies. Just a second. Just one more second. Okay. So let me come on measures of morbidity. Yes or no? Are you people with me? Let me see if I can see your chat. Okay. I can see your chat. I guess I can see your chat. Yes. So listen. Measurements of mortality we have already covered. Mortality. So there are 6 measures of mortality we have already seen. But now I am starting with measurement of morbidity, not mortality. We are starting with measurements of morbidity. So how many measurements of morbidity you know? There are only 2 measures of morbidity. Mortality have 5 measures. 6 measures. We have already covered these 6 measures. The measurements of mortality we have already covered. Mortality, but morbidity is the disease. Mortality is the death. Morbidity is the disease. That is not well-being, which is deviation from the well-being, you can say. So it is morbidity. So measurements of morbidity are only two: incidence of a disease and prevalence of a disease. So how are these measurements of morbidity related to the morbidity? Okay, what do you mean by morbidity? As I've told you, morbidity is a disease. Let me take an example of tuberculosis. Just suppose tuberculosis, of course, it is a disease. It is caused by a bacteria, Mycobacterium tuberculosis. We know it. So if I am giving a task to you, if I am asking to you that in 2021, what is the measurement of TB in India? In 2021, please give me the measurement of TB in India. Please give me the measurement of TB in India. So how you will calculate? You will say, ma'am, in India in 2021, in 2021, how many cases of TB were there? That will be the numerator. That will be the numerator. So numerator is the new cases. How many new cases of TB have arrived? Now, it may happen that 2021 starts from 1st January, of course, and its end at 31st December. Yes, so we know this is the duration of 1 year in 2021. So it may happen many new cases of TB have appeared, have diagnosed during this 1 year. So the new cases are considered as incidents. And there may be a possibility that there are many patients who have TB before this and they are continuing in 2021. So 2020, 2019 to 2018, they were diagnosed in this year, not in 21, but they are not cured and they are continued to have TB in 21 also. But they are not new cases, they are the old cases. So prevalence is the total cases, including new plus old, both cases. If we take only new cases of that particular year, it is the incidence. If we take total cases of that particular year, it is the prevalence. That is the basic difference between incidence and prevalence. That is the numerator. That is the numerator in each of them. What is the denominator in each of them? Denominator is the population at risk. Population at risk. How many population? What do you mean by it is not mid-year population? Out of the mid-year population, no, for TB we don't have any vaccine. Just for suppose I am asking about COVID, I'm asking for some disease, I'm asking for diphtheria, for which vaccine is available. So out of the mid-year population, the person who are already vaccinated, I will exclude them, or the person who have already infection, I will exclude them because they have the immunity. So they are not at risk. They do not have the disease again because either they are vaccinated, vaccination provides protection, or they are infected. So infection also provides protection. So in the denominator, I am writing population at risk instead of mid-year population. So instead of mid-year population, population at risk is a better terminology to understand it. Right. So one is incidence, one is prevalence. So in incidence, it is the new cases upon population at risk. In prevalence, it is new plus old case upon population at risk. Have you got it? Have you got it? What I am saying? Have you got it? Here the multiplier is 1000 and here the multiplier is 100. So you tell me. So incidence is a rate, but prevalence is a proportion. In both of them, the numerator is a part of denominator. The new cases or new plus old, both cases. Both are from population at risk. Both are from, so numerator is a part of denominator. But here multiplier is 1000, here multiplier is 100. So one is rate and one is proportion. I hope I am crystal clear in my concepts. Do you understand it? So I have taken an example of tuberculosis. Just suppose I am giving you a task that in India in 2021, tell me the morbidity of TB. Morbidity of tuberculosis. I can ask you this question for any disease. Let me take example of TB. So you can do it two way. You can calculate that how many new cases appeared of TB in 2021 or how many total cases Total. By total, I mean new plus old. New plus old. Cases of TB appeared in 2021. So in 2021, from 1st January to 31st December, this is the duration. From 12 midnight to 12 midnight. This is the duration. Yes or no? In this duration, there may be new cases which appeared here. First time they are diagnosed here. So they will come here. And there may be cases which are diagnosed previously, but they are not cured and they are continuing in 2021 also. They are not cured. They are not treated. They are not dead. They are diseased, but diagnosed before 1st January 2021. Before that. So they are the old cases. So if I am taking the numerator total new cases upon population at risk, it is incidence, right? If I'm taking total cases, that is new plus old, upon population at risk, it is the prevalence, right? Now, as I've told you about the multiplier, here multiplier is 1000 and here multiplier is 100. That's why incidence is the rate and prevalence is the proportion. Prevalence is the, so this is incidence, this is prevalence. This is how you can calculate the morbidity of any disease, not only TB. Any disease. Instead of TB, I can say diabetes, I can say cancer, I can say anything. So in the same way, you can do it. So there are two indicators. Have you got it? Incidence and prevalence. If you have any doubt, please ask. Otherwise, I will show you the theory portion and then we will solve some numericals based on it. Okay, let me see. Okay. If you have any doubt, please ask. Please ask specifically. Incidence and prevalence. So morbidity is of two types. We can measure morbidity by two indicators, incidence and prevalence. Have you got it? So let me take an example of TB as I have told you. So what is incidence? What is incidence? Here you can see this is the formula of incidence. Look at the formula. Don't look at the definition. You will get confused. Look at the formula. So what is the numerator? Number of new cases of that particular disease in that year. So here my disease is TB and my year is 2021, just in the example, right? So in 2021, how many new cases of TB appeared in India? My location is India. My location is India. So you should know your year, you should know your location, you should know your disease. So how many new cases of that particular disease appeared at that location in that year? That is the numerator upon total population at risk. So you will ask me, ma'am, what is the difference between mid-year population and population at risk? Instead of population at risk, can I use mid-year population? From the mid-year population, if the persons are vaccinated, exclude them. Or if the person are already infected in the past, exclude them because they have protection. They will not have the disease again because they are protected either by vaccination or infection. So instead of using mid-year population, better to use population at risk because the one who already vaccinated, he will not have disease. So why to take it in denominator? Here, the numerator is a part of denominator. The person who are the new cases of TB are from population at risk only. So population at risk, few of them will have TB. So numerator is a part of denominator and the multiplier is 1000. It is 1000. That's why incidence is a rate. Now read the definition. It is the number of new. I am focusing on the word new. New. It is the number of new cases occurring in a definite population. Definite population is my Indian population during a specific period of time. A specific period of time is my 2021 year, 1st January to 31st December. Per thousand. Multiplier here is 1000. Have you got it? So from 1st January 2021 to 31st December 2021, how many new cases are diagnosed which were not previously diagnosed? So that will be my incidence. Have you got it? So incidence depends on four things. How many new cases are there? That is the numerator. What is the population at risk? That is the denominator. A given period of time, usually one calendar year. Here in my example, I have taken 2021. I can take any year. And you require a multiplier which is always 1000. So give me a big thumbs up if you got what is incidence. What is incidence? So incidence is a rate because here the multiplier is 1000. It is not 100, it is 1000, right? And incidence always include a unit of time, which is 1 year. Without that, you cannot calculate incidence because you have to calculate new cases. Now, so new cases between what and what? You need a specific time duration between 1st January to 31st December. That is my time duration in which I will see for new cases. So you will always require time, right? That is the thing. It is usually calculated for acute disease, not chronic disease. And it does not depend on the duration of disease. I am looking for the new cases. This is 1st January and this is 31st December, right? And this is the duration. So this is my new case, just suppose. This is my first case diagnosed, second case, third, fourth, fifth. These all are new cases. Now, once they are diagnosed, whether they carry TB only for 1 month or they carry TB for the whole year, it doesn't matter. So duration of the disease doesn't matter here. right? So they are once diagnosed with TB, that's it. So it is a new case. Now, whether it is treated within 1 month, or whether it is treated in 6 months, or whether it is treated in 1 year, or whether it is continuing in the next year, it is not my problem. Have you got it? So it doesn't depend on duration. Have you got it? Rishinika, Iram, have you got it? Give me a thumbs up. So please everyone learn the formula of incidence. Incidence, numerator new cases, denominator population at risk in 2000 in 1 year. So there should be a time specifier. So it can be 1 month, it can be anything, but time specifier is usually 1 year. Multiplier is always 1000, always 1000. Numerator denominator is fixed. New cases upon population at risk. Everyone give me a thumbs up. So can you see a beautiful exam given in the park? Park is a very good, the best author, I must say, for the community medicine. So this is an example. It's a very simple example. You can see a tap here. From the tap, water is coming out. This water, and it is accumulated in a bucket. It is a bucket with a hole, small hole at the base, right? So water is exiting out from this hole. So water. So what is the incidence here? Incidence is the new cases which are added. So what are that is the new water. So this is the new water in specific. So if I decide the time in 1 hour, in 1 hour, how many new water is coming? New, fresh water. It is not the old, the fresh one, right? The new one. So the new in 1 hour, 1 minute, I can say any time specifier. 1 hour, 1 minute, 1 day, 2 hour. So that is my time specifier. Usme kitne new water is coming, that is the incidence. So incidence is the new water. Once it is coming in that tub, in the bucket already old one is present and new is also adding in it. So old plus new will become the prevalence. So the storage in the bucket is prevalence. Have you got it? Whatever is adding from the tap is the incidence, and whatever is present in the bucket, that is old plus new. So it is already having the old previous one also, and new one is also added. So if I am saying that from 10 o'clock to 11 o'clock in the morning, what is the incidence of water? So whatever new water coming in this time period, that is the incidence. But before 10 a.m. at 9, 8, 7, the water is also present previously also. So the new water along with the old water, that will be the prevalence. Now what is this exit? Now all these people are diseased. All these people have disease. Now there are only two fate of disease. If the patient have any disease, either death will be there or recovery will be there. Right? Only two exit. If you want to exit, or either you will be diseased forever. Right? If you want to exit this bucket, there are two escape, either death or recovery. Right? So disease have two fates. If anyone have any disease, by disease I mean morbidity have two fates. Either the person is dead, so he is escaped from the disease, now he is dead, right? And or he will recovery. So only two fate of disease of morbidity. Give me a thumbs up, that is the exit. Everyone give me a thumbs up. So that is the incidence prevalence ka diagram, right? So we will try to solve this question in front of you. Please everyone participate. Everyone, those who are listening, please participate. If there are 500 new cases of a illness is not defined which illness it is, TB, diabetes, what it is, any illness. There are 500 new cases in a population of 30,000. 30,000 is the mid-year population or population of that area in 1 year. 1 year, what is the incidence? What is the incidence? So please apply the formula. Incidence is equal to new cases upon population at risk. Population at risk in 2000 new cases in 1 year. So what is the new cases in 1 year here? It is 500 upon, ideally it should be population at risk. Now in the question population at risk is not given, so I will consider mid-year population as population at risk only. I will consider out of this population mid-year none is vaccinated, so I will take it as population at risk only, right? In 2000 you do your calculation, whatever is the answer, that is your answer. Please apply it. So 500 upon 30,000 into 1000, answer is 16.7. So my answer is 16.7 per thousand per year. So what does it mean? What does it mean? In 1 year, if my year is 2021, it can be any year. So in 2021, every 1000, 16 patients have TB. If my illness is TB, every 1000. So first 1000, 16.7 will have TB. In the second 1000, 16.7 will have TB. In the third 1000, 16.7 will have TB. So this is the unit. You can say this is the unit of incidence. The unit of incidence is per thousand per year. Per thousand per year. is the unit for incidence. This is the value. So if you can't write only 16.7, if you have written 16.7, your answer is wrong. The correct answer is 16.7 per thousand per year. So learn the unit of incidence also. Everyone give me a thumbs up. I'm really trying hard to explain you. Have you got it? Have you got it? What are the uses of incidence? Incidence is used to control the disease. What do you mean by that? If I say in India, the incidence for TB is 16 per thousand per year, per thousand per year. And incidence of, this is for TB. This is for diabetes. For diabetes, it is 12 per thousand per year. For stroke, these are rough examples. For stroke, it is 20 per thousand per year. For CVD, it is 22 per thousand per year. So you will see the values. So the government, the health minister, the government will see the values of incidence of various diseases in India, right? And depending on that, the disease which is having more incidence. So in that way, they took control measures. They take control measures to control the disease. So what the measures government is taking to control the disease, they are framing various programs, various health programs in which the persons having these disease, they are screened in free, they are treated, they are diagnosed free. So various health programs are created based on the incidence ka data. So incidence ka data is available with our health ministry, and they look at the data, and depending on that data, they compare that in India which disease is more, which is less, new cases किसके ज़्यादा आ रहे हैं. So in 2021 सबसे ज़्यादा new cases किस disease के आए. So they will either, if either health program is already present, so they will reformulate it कि why still health program is present, फिर भी वो control क्यों नहीं हो रही. So they will take various measures to control the disease. Give me a thumbs up. And incidence is also useful in etiology and pathogenesis of the disease, to understand the etiology and pathogenesis of the disease, right? And to take the preventive and therapeutic measures, right? So we take all the measures based on the incidence. I'm really sorry, based on incidence, not on prevalence, right? So we are done with incidence. Let me come on prevalence. Am I visible to you? Okay, I hope I'm visible to you. My one of the lamp is gone, I guess. Let me see. One of the lamp is gone. Okay. Give me a minute. Okay, done. So let me come on prevalence now. Let me come on prevalence. So prevalence is of two types, point and period. What do you mean by that? I will explain you. So what is prevalence first? I will come on the types later on. What is prevalence? It is all total cases. Total. It includes new also, old also. Not only new also, old also. And denominator is total population at risk. The same population at risk is the denominator. But multiplier is 100, not 1000. That's why it is a proportion. It is not rate, it is a proportion. So it includes all cases, all current cases, including old as well as new. Have you got it? Including old. So that's why it is a proportion. So incidence is a rate, prevalence is a P for P. Prevalence is a proportion, right? Give me a thumbs up. So in this diagram, I have already explained you what is incidence. The new water coming from the tap is incidence. And new plus old water present in the bucket is the prevalence. So you can understand incidence and prevalence in this beautiful diagram. Now you will never forget. You can draw this diagram in your university exams also. As I have told you, it is of two types. Let me explain you the two types of prevalence, right? So I cannot say 2021 here. Here time specifier is not required, right? It can require, it cannot require. So point is at that point. Just suppose if I ask you at this instant, what is the time now? It is 10:05 a.m. 10:05 a.m. Sharp 10:05 a.m. in the morning on 21st Feb. Right? Today date is 21st Feb 2021. This is the date today. So this date pe, this is the time today. So at this point, at this, take a snapshot. Take a snapshot at this point of TB cases. All the TB cases in India, take a snapshot. Is point pe. So not in the entire 2021 I am asking you. In 2021 on this date at this time, how many cases of TB are present, old plus new? That is the point. At that point, what is the prevalence? At that particular point. So it is like a snapshot. If no, in your camera, you have two features. One feature is snapshot, and one feature is video recording, right? Video. So video is something you record from one point to another point. Snapshot is that instant. So you can say snapshot is instantaneous. Instant. At that instant, it is shooting. And video is not instant. It is between this to this. There are 2 points, point A, point B. Between two time frames, point A and point B, you are taking a video, cinematography or video. Have you got it? So you can say point prevalence is like snapshot. It is like snapshot. So I will give you any particular time that in 2021 on 21st Feb सुबह 10:05 पे टीबी के कितने केसेस हैं. So you include old plus new, all cases. Don't see who is old, who is new. Whatever TB is present, that is the point prevalence at that point. Have you got it? And if I give you any particular period, not the point, at particular period, that in the entire February in 2021, starting from 1st Feb to 28th Feb, in the entire February month, tell me the prevalence, tell me. So you will see again old plus new cases in the entire month. It is not a snapshot, it is a video like. So you are starting your camera video at 1st February 12 a.m. right? And you are closing your video, you are shutting down your video at 28th February at 12 a.m. So you have taken all old plus new. इसमें old जो already running out cases हैं पहले से आ रहे हैं वो भी include करो and the new diagnosed वो भी include करो. So that will be your period prevalence. It is like a video recording. Now you will never forget. So what is the snapshot and what is the video? So with your camera you take snapshot also. It is capturing at that instant. And you take video also. So video is capturing between two time frames. Video is never instantaneous. It is between two time frames. Have you got my point? So this is the language you will get in PAR, right? So give me a thumbs up if you are getting it. Everyone give me a thumbs up. So what is point prevalence? Point prevalence is all cases. Of course, that is new plus old. But at one point of the time, that is at that instant. That is the snapshot. That is the snapshot at that instant. So this is the same formula, but only thing at a given point, and the period is again all cases, old plus new, but during a defined period of time. It is not a point. It is not one point. It is not one point. It is one period. Period is between two time frames, A and B, right? So between a given period. So if I say 1 February, 1 year, so starting from that point to that point. So it is like a video recording. It is like a video recording, right? Give me a thumbs up. Give me a thumbs up. So what are the uses of prevalence? What are the uses of prevalence? So just suppose after completing your MBBS or your MDMS, you think that, ma'am, I will open a hospital in my area. That is my dream. I will open a hospital. Okay. So you are residing in a city. Just suppose this is the map of your city and you want to open a hospital here in this area. So before, you cannot just start to make a building, right? Before that, you have to do a planning and you have to do administrative purpose. So how big the building should be, that depends on the population in this area and other hospitals available in this area. How many staff, how many doctors, how many nurses, how many healthcare providers, how many beds you will keep in your hospital. It is not your wish. It is not कि मैम वो तो जितना पैसा होगा उतना कर लेंगे. No, it is not your wish कि how many bedded hospital you will make in a particular city. That depends. Just suppose you are making a hospital only for TB patients. So it depends on the prevalence of TB in that area. So you won't see incidence because in hospital old cases will come as well as new cases, both will come. So for that hospital you need total cases. They both will come in your hospital for treatment, old also, new also. So you want to know the total cases in your area, in your city or in your area where you are planning to open a hospital. You can open hospital for any particular disease. It is a multi-specialty hospital also. It is for one particular disease also. So you have to see the prevalence. Not in here you will not see incidence. You will see what is the prevalence. So based on the prevalence, then there should be some number now. So prevalence of TB in my area is that. So every year इतने लोग तो आएंगे ही per 1000. इतने लोग every year they will come in my hospital, right? Because there is no other hospital in vicinity for TB. So depending on that, you will decide your bed number. Depending on that, you will decide your doctor's number. Depending on that, you will decide your nurse's number. So there is a proportion. So for planning and administrative purpose, how many beds, how many manpower in a hospital is needed, you need prevalence. You don't need incidence. Have you got it? So what are the uses of incidence and what are the uses of prevalence? What are the uses of incidence? I told you previously also. Incidence is used to control the disease. Control. So our health minister every year see the incidence of all disease. So there is a list in front of health ministry that incidence in India in 2021 is already passed. So in 2021, this is the data. This is the incidence for TB. This is the incidence for diabetes. This is lung cancer. This is brain cancer. This is breast cancer. This is diabetes. This is this. So for all disease, we present a list to our health ministry. So So based on that list, the health ministry will decide ki incidence of this disease is more, this is more. So we should do something to control it. We should. So control measures, that is based on new cases, the new cases which are coming. But and preventive and therapeutic measures are also based on incidence. So the control measures, preventive measures, therapeutic measures, and क्या कहते हैं, etiology and pathogenesis, research work, ये सब के लिए incidence is required. But for planning and administration, you require prevalence. You require total cases, not the new one. You should understand the difference between two. If you want to open a hospital, see the prevalence of disease in that area where you want to open the hospital, right? For which disease you are opening your hospital, right? So you have to see the prevalence, because not only new cases will come in your hospital, old plus new both will come in your hospital. So you have to look for the prevalence. But if government wants to make a health program for any particular disease, so health program will be it is the budget. Now the budget is passed before a few days before now, you know. So when budget is passed now, so some percentage of total GDP is given, of course, to the health, to our health ministry. Some percentage is given. So from the health ministry, that money, how the health ministry will utilize in various disease, who will decide ki out of that total money how much we will give to TB, how much we will give to diabetes, how much we will give to cancers, how much we will give to other chronic diseases. Who will decide? So it is not a man who will decide कि चलो टीबी को इतने lakhs sanction कर देते हैं, diabetes को इतने करोड़ sanction कर देते हैं. No, it is not manual. You have to see the incidence of all. The disease who is having more incidence, more budget is sanctioned for that disease. Then the disease who is having less incidence, less budget is sanctioned for that. So that is for controlling the disease. The health programs are made based on incidence. That is my point. Give me a thumbs up. You got the uses, you got the formula of both of them. Everyone give me a thumbs up. Prevalence is not used for etiology. Etiologically incidence, right? Have you got it? So do you have any problem in understanding this? So have you understood that incidence is a rate and prevalence is a proportion? This point I will explain you later on. There are two types of studies, cross-sectional and cohort. I will come out on it later on. If you have any problem, please ask. Feel free to ask. Iram, Rishinika, anyone else? Please feel free to ask. If not, I will proceed ahead. Kuldeep, I will proceed ahead. Right. So should I proceed? Should I proceed? Okay, just a second. So let me summarize incidence and prevalence. Incidence and prevalence are the two measures of morbidity of a disease. Morbidity. These are not mortality. Morbidity of a disease, right? In incidence, we see only new cases, right? In prevalence, we see all cases. New plus old. All cases. We see all cases. That is the numerator. So here the numerator is new cases. Here the numerator is all current cases, right? Denominator in both of them, either you say population at risk or mid-year population. By population at risk, I mean that from mid-year population exclude the vaccinated one. The one who are vaccinated cannot have disease again. If I am vaccinated for diphtheria, I will not have diphtheria. If I am vaccinated for COVID, I will not have COVID, right? So vaccinated person को नहीं हो सकता, तो it is not useful to take them in the formula, no? So instead of mid-year population, take population at risk. It is a better term. But if in your question, if population at risk is not given, so consider mid-year population as population at risk. Consider no one is vaccinated. You can do this consideration. So here also numerator is a part of denominator. The new cases are from population only. Here also numerator is a part of denominator. All cases, new plus old, are from population only. But look at the multiplier. Here the multiplier is 1000 and here the multiplier is 100, right? That's why it is a rate. That's why it is a proportion. Everyone give me a thumbs up, right? I have told you the uses of each of them. So here the incidence is used for controlling a disease. Controlling a disease, controlling the disease, for therapeutic measures, for preventive measures, and for etiology, knowing the etiology of the disease. Proportion is used for planning and administrative purpose. Planning and administrative. So you have to learn. This is the summary. If you have any doubt, you can ask. Otherwise, I will proceed. Done. So if you know the formula of this and this, please learn the formula. It is 1000 here, 100 here. We will solve some numericals. We will solve some numericals based on it, and then I will proceed ahead. Done. I will correlate and proceed ahead. Okay. First, let me explain you this example. Then I will ask you questions based on it. Right. How many questions I will ask? I will ask 4 questions, one by one, right? First, let me explain. See, This graph is 2021. Any year you can consider. Listen, this is 1st January. You see it is written here. This line, this vertical line you can see, I'm drawing with blue. This is 1st January. Date is 1st January 12 a.m. This is 31st December 12 a.m. This line is 31st. So you can see the distance between the two lines starting from here to here. It is 1 year, complete 1 year, right? Complete 1 year, maybe 2021 or any year I'm talking about, right? You understand this, right? In this, the circles is the new case arising. So just suppose this circle I'm marking with red. This is before 1st January. This is also before 1st January. And this one is also before 1st January. This one is after 31st December. This one is after 31st December. And the remaining this, and this is between 1st January to 31st December, you can see. You have understood the diagram, right? That is the circle. What after about the circle के बाद line का क्या मतलब है? What is the meaning of this line? First understand the diagram. This line is the duration of illness. This line. So this is the start of the disease. He is a new case which is diagnosed before 1st January. Maybe in 2020 he is diagnosed in the November, December. Just before January he is diagnosed. And he is having illness throughout the 2021. And he is cured after 2021. So this is the cure. So this is the duration of illness. This is the duration. So line is the duration of illness. You got this diagram? Have you got this diagram? Have you got this? If you got this, give me a thumbs up. So what are the two blue lines? These are the two time frames starting from 1st January till 31st December. What are the red circle? Red circle means new case. And what is the line of the red circle? This green line I'm drawing. It is the duration of illness. So this case is treated in few months, but this case is not treated. Maybe he's not taking the treatment. That is why he's diseased throughout the year. Everyone give me a thumbs up. If you got this diagram, answer this. The 4 options are in front of you, A, B, C, D. You can see the 4 options in front of you. What is the incidence? My simple question, what is the incidence? So you know the definition of incidence, apply it. What is the incidence of this year? Incidence of disease in 2021. What is the incidence? Who will tell me what is the incidence? Kuldeep, Iram, Rishinika, anyone else? So starting from 1st January till 31st December, you can see the 2 lines. What is the incidence? In incidence, how many? There are 8 patients in this diagram. You can see this is patient number 1. This is patient number 2. This is patient number 3. They are written case 1, case 2, case 3. This is case 4. This is case 5. This is case 6. This is case 7. And this is case 8. Out of the 8 cases, which cases you will include in incidence? What is the definition of incidence? Who will tell me? Apply the definition. Now, incidence is number of new cases in that year. Not the old one. Only the new one. Only the new one in that year. Particular year. I am talking about that particular year. So starting from 1st Jan. See, this is 1st Jan. Till 31st December, between these 2 lines, how many new cases are there? So Iram is saying A. Let me see Iram. So I will not take this case because this case 1 is before 1st January. It is not in that duration. I will not include 2 also. I will not include 7 also because these 3 are before 1st January. I will not include case 6 also because it is after 31st December. Between that period, only 4 cases are there. That is case 2, case 4, case 5 and case 8. So 2, 4, 5 and 8. Where is the answer? Sorry, it is 3, not 2. 3, 4, 5 and 8. So 3, 4, 5, 8, A is the correct answer. Have you got it? Yes, Iram. Yes, Rishinika. A is the correct answer. Have you got it? Why I have excluded remaining? Because few of them are before 1st January and few of them are after 31st December. I do not take it. I will not take it. I will take only new cases in that time period. So that is my incidence. Everyone give me a thumbs up. Everyone give me a thumbs up first. Everyone. So this is my answer here. This is my second question to you. I am asking you point prevalence. I'm asking you point prevalence. You know the meaning difference between point and period prevalence. I'm asking you point. So what is my point? You have to take a snapshot now. Point means snapshot. Take the snapshot at 1st January. 1st January is your point. Take a snapshot there. So this is the 1st January. 1st January pe snapshot lo. Take all cases. Prevalence means all cases. Old plus new. So take all cases at 1st January. So can you see 1st January? So take all cases at 1st January who have disease. Who will tell me the correct answer? So at 1st January, I can see this, this and this. Only 3 people have disease which are crossing this line. So at this snapshot, I'm not taking the entire scenario. No, I have to take a snapshot only at 1st January. That is point prevalence. So this one is case 1, this one is case 2 and this one is case 7. So 1, 2, 7 is my answer. 1, 2, 7, that is B my answer. Yes, Iram, Rishinika, Kuldeep, very good, very good. B is my answer. Have you got it? Third question you already know. Now take the point prevalence at 31st December. Now take a snapshot. Point का मतलब है snapshot. Take the snapshot at 31st December. Don't take the snapshot there at 1st January. Take the snapshot here. How many cases? Take total cases. Total old plus new at this point. At this point, how many people have disease? Let me see. This is having disease. This is crossing it. This is crossing it, and this is. So 4 people are crossing this line. So 4 people have disease. So case 1, case 3, case 5, and case 8. So 1, 3, 5, 8. This is the answer. Yes, very good. Very good, Rishinika. This is the answer. So this is point prevalence at 31st December. Everyone, yes, Kuldeep. Very good. Have you got it? This is the answer. And if I ask period prevalence, my last question, what is the period? Period is the video. It is not snapshot. Take a video, cinematography, right? So it is a video. Video prevalence between 2 points. If you want to take a video, there should be 2 points. Point matlab snapshot. In snapshot, you require 1 point only. It is 31st December, it is 1 point, not 2 points. Here it is 1st January, 1 point. But if you want a period, you have to be 2 points. 1st January to 31st December. So these are the 2 points, okay? This is 1st January, okay? And this is 31st December. Make a video between the two. So include all cases between the 2 points, between these 2 points. Isse include all old plus new. Old plus new, both cases, old B and new B. So include all cases. Who will tell me the correct answer? Who will tell me the correct answer? So between this point, case 1 is crossing this point. You see, case 2 is also a little bit crossing. Case 3 is also there in this point. Case 4 is also there. Case 5 is also there. But case 6 is not there. Case 6 is diagnosed as well as carried on after 31st December. I will not include it. It is not coming between 2 blue lines. Case 7 a little bit is there. Case 8 a little bit is there. So excluding 6, all are the options. So it is 1, 2, 3, 4, 5, 7, 8, not 6. So you have to understand the concept. Now you can imagine how many new MCQs can be framed based on this concept of incidence and prevalence. Give me a thumbs up if you got it. Everyone give me a thumbs up. So this is one of the example given in PAR. Every student knows this example. If you have read PAR, you know this is a typical example from PAR only, right? Give me a thumbs up. But many new questions can be framed by the examiner based on this data. So you should know the concept. So you should know the concept. So what is the concept? The concept is that morbidity can be measured by 2 ways, incidence and prevalence, right? Incidence includes only new cases. Prevalence includes all cases, new plus old. Incidence can no further type, but prevalence is of 2 types, point and period. In point, it is the snapshot. So you require 1 time only, 1 time frame. But period is the video. So you require 2 time frames. So at that 1 time frame, consider all cases. Between 2 time frame, consider all cases. It is old plus new. Everyone give me a thumbs up. I really tried hard in explaining you this. So you know the formula and you know how to apply it. Now see this diagram again. Everyone have a look in this diagram again. Everyone. What is the incidence? इंसिडेंस का मतलब क्या होता है? इंसिडेंस मतलब न्यू केसेस ना. व्हाट इज इंसिडेंस? इंसिडेंस मींस न्यू केसेस. सो न्यू केस इज द स्टार्ट, जस्ट द स्टार्ट ऑफ द स्टार्ट. सो ही इज अ न्यू केस डायग्नोस्ड. आगे इसका इलनेस कितना चला दैट डजंट मैटर. सो ही इज इल्ड, दिस पर्सन इज इल for the entire year and for the next year also, but that is the duration of the illness. That line is the duration of the illness. So here is a new case, that is the duration. So the line is the duration of the illness. So prevalence क्या है? What is the prevalence in this diagram? Prevalence is incidence as well as duration. So what is the relationship between incidence and prevalence? So prevalence is equal to incidence into duration. Have you got it? So what is prevalence? Prevalence is old plus new. तो ये तो हो गया new और ये हो गया old. So new और duration को into करेंगे तो we will get the answer of prevalence. If you are getting from the diagram, it's okay. If you are not getting, learn the formula. Prevalence is equal to incidence into duration. I am saying this. Please learn this formula. Prevalence is equal to incidence into duration. Everyone give me a thumbs up. Everyone. So prevalence of the disease is directly proportional to 2 things. It is directly proportional to incidence also. It is directly proportional to duration of illness also. You have to understand this concept. Now, it is a difficult concept I am going to tell now. Prevalence is equal to incidence into duration. Duration of illness. So can I say prevalence is directly proportional to incidence? And prevalence is directly proportional to duration of the illness also. Give me a thumbs up if you got this. ऐसे तो बहुत simple है. Let me apply it and make it difficult, make it complicated. Okay. So you got this formula. Let me explain you few things based on this formula. Okay. So can I say longer the duration, more is the prevalence, and shorter the duration, less is the prevalence? Right? Longer the duration of illness, more is the prevalence, and shorter, if I'm not taking incidence in consideration, shorter the duration of the illness, less is the prevalence. Give me a thumbs up. Give me a thumbs up. So why in India? Uh, you tell me reason why in India the prevalence for TB is more. Prevalence of TB is more. Why? What is the reason? What is the reason? Because TB का incidence इतना ज़्यादा नहीं है, but duration is more. Once any person have TB, even after treatment, he will be a case for the next 6 months. 6 months तक तो treatment ही चलेगा. उसके बाद he will be negative. Right? And if we don't take the treatment, it will be for a year or a 2 or a 3. So duration is more. Incidence नहीं है ज़्यादा इतना TB का, but duration is more. So since duration is more, its prevalence is more. So if you find out total cases of TB in India right now at this point, today, if you say कि ma'am, okay, I will see all total cases today, you will get a high answer. So because it is not the incidence which is more, it is the duration which is more. So like the diseases which have more duration of illness, they have more prevalence. We got this point. Now let me come on the diseases which have short duration of illness. So they will have less prevalence. Short duration of illness. Why the disease can have short duration of illness? Please understand my point. Why the disease can have short duration of illness? Why any disease? I'm asking to you, Kuldeep, Iram, Rishinika. Why any disease can have short duration of illness? Why? How it can be? Short duration of illness क्यों हो सकता है? There can be two reasons. Why the disease have short duration of illness? Number one, you can say, ma'am, better treatment is available for that disease. So we have given the treatment and disease is cured. So better, good treatment options we are having for that disease. That's why that the disease may have a short duration of illness. Yes or no? Agreed? Agreed. The second way around, no treatment is available. No treatment is available for that disease. So the person is dead. Person is dead. Person is dead. Mortality. Person is dead. So again, the person, just suppose rabies. Person have disease and within 2-3 days, the person is dead. We don't have any treatment for rabies. Right? Person is dead. So duration is gone now. It is switch off. So there is no further extension of the duration. Give me a thumbs up. So students usually understand the first reason, but very few students understand the second reason also. So less duration ke we have two options. So if the disease is longer to simple hai. If the disease is longer, prevalence is more. Prevalence is more. Like TB is the best example. Right? Longer the disease, more is the prevalence. But the disease is of short duration. There can be two options. Either recovery is very fast or death is very fast. Either good treatment is available, so recovery is fast. Or no treatment is available, so death is there. Death is there, disease is fatal. In both of them, I'm sorry. In both of them, you will find less prevalence. Now, if you say, ki ma'am, let me see some disease for which good treatment is available and because of the good treatment, it is of short duration. So just say any disease, any just suppose you can say any cough and cold. So we all have cough and cold very frequently. Currently, I am having cough and cold. So cough and cold, the person can have, but it will be treated within 7 days, maximum 7 days, right? So, and treatment is available. We have symptomatic treatment available for it. And take the example of rabies. So both of them have low prevalence, but reason is different. Here the reason is that recovery is fast. Recovery is fast because treatment is available. Here no recovery, death is the only option. That is the reason. Have you got it? But both of them have less prevalence. Have you got it? Have you got it? So that is the meaning of duration. If duration of the disease is more, prevalence is more. We got this point. But duration of disease is less, prevalence is less. We got this point also. But duration is less because of two reasons. Either recovery is fast because of good treatment or death is fast because of no treatment. So either good treatment options available, so recovery is very fast, or no treatment options or poor treatment options available, so death is very fast. In both of them, less duration, so less prevalence. Everyone means everyone. Give me a thumbs up. Now I will further complicate this formula only. ये तो पहला concept था based on duration. ड्यूरेशन में हाई ड्यूरेशन में कुछ प्रॉब्लम नहीं है, लो ड्यूरेशन में इस पॉइंट में थोड़ा सा समझ लो. राइट? ओके ओके. My next question based on this formula. You see the formula and you have to answer the question. What is the formula? The formula is prevalence is equal to incidence into duration. My question to you, please everyone listen the question. Rishinika, Kuldeep, Iram, anyone else, please listen the question carefully and you have to answer. What is the effect of treatment? Effect of treatment on prevalence. If I give treatment to any diseased patient, what is the effect on prevalence? The two options are whether the prevalence will increase on giving the treatment or whether the prevalence will decrease on giving the treatment of any disease. I'm not saying any particular disease. That is my question. What is the effect of treatment on prevalence? Prevalence पे effect बताओ treatment का, and with reason. Reason भी बताना है तुम्हें. What is the reason? Why it will increase or why it will decrease? So less prevalence. Who is saying less prevalence? Decrease. Kuldeep is saying it will decrease. Okay, Kuldeep, let me see. Rishinika is also saying it will decrease. Iram, what you will say? Anyone else is watching it live? Please submit your vote. At least say something. Nah, at max you will be wrong. Don't worry. If you will be wrong, it's okay. Everyone please participate. So Kuldeep, if the drug is effective. Kuldeep, say one thing, right? Or give me the reason, valid reason. So what will be the effect of treatment? Yes, the drug is effective. Consider that. Anyone else? Anyone else? Iram also saying decrease. Anyone else who is listening want to submit their vote? So what is the effect of treatment on prevalence? So all the students are saying the prevalence will decrease. You all are wrong. You have to say, ma'am, it can increase, it can decrease, both can happen. Both can happen. It can increase also. How? How? It can increase also, it can decrease also. Both things can happen on giving the treatment. You will say, ma'am, how it will increase? Decrease to samajh mein aata hai. Okay. There are some treatment which cure the disease. The treatment I have given, the disease is cured. So on giving the treatment, the duration of illness is less. The patient will be cured soon. Just suppose if the person is I'm having a disease, right? If you give me the treatment, I will be cured. So my duration of illness will be less. I will be treated in a week, in a month. So duration will be less. So prevalence will be less. There is no effect on incidence, right? You have to understand. But decreasing the treatment works on duration. Treatment don't work on incidence. Incidence to already ho chuka hai. You are already a case. You are already a case. Please understand. The person is already a case. The patient is already a case, a new case. Incidence to already happen. Treatment don't work on incidence. Treatment work on duration. If you are giving the treatment to a person, you are decreasing the duration of illness. By decreasing the duration of illness, you are decreasing the prevalence. Yes or no? Yes or no? So you all have this concept. That's why you have said the duration will decrease, so prevalence will decrease, right? But there are some treatment which do not cure the disease. There are some chronic disease which are not cured, but the disease is in control, which control the disease. Let me take example of hypertension. Let me take example of diabetes. The two best example I can commit here. So your parents, grandparents may have hypertension. All 80% of the people after 60 years of the age have hypertension. So maybe my parents are hypertensive also. They are diabetic also. My grandparents are hypertensive. So at our home, we see most of the patients in our neighborhood, in our hospital, they have hypertension. They have diabetes. Is there any cure for hypertension and diabetes that you take a course for 7 days, you take a course for 1 month, so your hypertension is cured? No. Daily you have to take one tablet antihypertensive drug. So for that day your hypertension is controlled. The next day if you don't take the tablet, you will be hypertensive. So the disease, what is the treatment offered? The treatment is controlling your disease but not curing it. Your disease, so you will die with hypertension only. Once you have hypertension, your death will be hypertension only, it is certain. The disease is not cured. It will be never cured. But till you are alive, you can keep it in control. You can keep it in control by taking antihypertensive drug. The only thing, you have to continuously take the treatment. It is not a course for 7 days, 1 month, 6 months. Daily you have to take it till you want the control. If you want the control, take it. Once you leave the treatment, antihypertensive drug, again you will be hypertensive. So that is the meaning of controlling the treatment which controls the disease. It is not curing. It is not like I'm having any acute illness, I'm having jaundice, hepatitis, or some food poisoning. So I'm taking a course of treatment and my disease is cured. No, it is not like that, right? Diabetes, again take the example of diabetes. In diabetes, the blood glucose levels are high. So if there is any cure for diabetes? No cure. The pancreas is already gone now. The beta cells in the islet of Langerhans of pancreas, they are already destroyed. Now you cannot rejuvenate it. You cannot re-survive it. They are dead. The beta cells inside the pancreas are dead. You cannot usko वापस alive नहीं कर सकते. So what you are doing, the treatment daily you give anti-diabetic treatment, hypoglycemic drug, or you give insulin to the patient daily. So artificial insulin you are giving from outside because your pancreas is not synthesizing it. So once you will give this treatment, your sugar will be controlled for that day only, for that 3-4 hours only. So if you don't take it, the next day again you will be hyperglycemic. The patient will be the patient will be hyperglycemic. Have you got it? So these are the diseases the patient do not have cure. Just suppose if you don't give the treatment also, what will happen? You will say, ma'am, the person will have high BP or high glucose. And if you don't give the treatment, the person will be dead within a year, within 2 years, within 3 years, 4 years. But if you give the treatment, the person can be alive for next 20 years, 30 years, 40 years, till normal age, normal normal death. So it will be nearly normal as the normal population once you give the treatment, because the disease is under control. So by giving treatment, what we are doing actually? What we are doing actually by giving treatment? By giving treatment, we are keeping alive the diseased people on the earth. The disease, they already have the disease. The person already have hypertension. The person is already having diabetes. So these are diseased person. If we don't give the treatment, they will die. They will die. So prevalence will decrease. The prevalence will automatically decrease. But we are giving the treatment. We are keeping them alive, and we are not curing the disease. The treatment is unable to cure the disease. The treatment is only controlling the disease. So they will always remain hypertensive. They will always remain diabetes, and their life is prolonged by giving the treatment. So disease person का duration हम बढ़ा रहे हैं treatment देके. Yes, we cannot let them die. Now that you have hypertension, now I want less prevalence of hypertension, so I will not give you treatment. No, I will give you the treatment. I will give the treatment to my patient. Of course, I want to increase the duration of the disease, right? So I'm increasing the prevalence by giving the treatment. Give me a thumbs up. Give me a thumbs up. You got the summary. You got the summary. So there are two type of treatment options available in the world: the treatment which cure the disease, the treatment which do not cure the disease but keep the disease under control, like diabetes and hypertension. The treatment which cure the disease will decrease the prevalence. The treatment which do not cure but control the disease will increase the disease duration. So here prevalence will decrease, here prevalence will increase. So treatment can do anything. So it is not the thing. My question was treatment. What is the effect of treatment on prevalence? Your answer should be, ma'am, both. It can increase also, it can decrease also. If the treatment is curing the disease, it will decrease the prevalence because it will decrease the duration of the disease. If the treatment is increasing the duration of disease, increasing the diseased people on the earth, not curing the disease but keeping it under control, that is diabetes and hypertension. So what we are actually doing, being a doctor, I'm prescribing a treatment for a patient that you will be always be diseased. Your hypertension and diabetes is never cured now. Till your death, you will have this disease, right? You are labeled now forever, right? But I cannot let you die, right? I will give you the treatment. The treatment will keep your disease under control. So you will be diseased. It's okay, but you can lead a normal life. You just forget that you have a disease. Take tablet daily. Take your treatment daily. So I am giving the treatment to prolong the life of a diseased person on this earth. Right? So I am increasing the duration of the disease by giving the treatment. On the contrary, it is not ethical that we shouldn't give the treatment to such patients that we want to decrease the prevalence of hypertension. Now you have hypertension, you have diabetes, it is a death statement. We will not give you the treatment. No, it is not the case. We give the treatment. We want to increase the duration, right? So the treatment can do the both ways. Everyone give me a thumbs up. So now give me the same question. Again, you give me the answer. So this is the formula in front of you. Prevalence is equal to incidence into duration. This is the formula. You know the formula, right? My question to you, what is the effect of treatment on prevalence? That is my question. That is my question. Yes? Who will answer now? Your concepts are cleared or not cleared yet? What is the effect of treatment on prevalence? On prevalence, what is the effect of treatment? Whether the prevalence will increase on giving the treatment or whether the prevalence will decrease on increasing the treatment. Everyone? Yes? What is the answer? Both. Both can happen. So what is the story? If the treatment is such which is curing the disease, so by giving the cure, the duration of the disease will decrease. Duration will decrease, so prevalence will decrease. So prevalence will automatically decrease. There are some treatment which do not cure the disease, but control the disease. So actually such treatment is increasing the duration of illness, duration of disease, duration of diseased person on this earth. It is increasing the duration. So increasing the duration means increasing the prevalence. So both can happen. Yes, can both. Yes, Rishinika, Kuldeep, very good. So both can happen. So next time you will not do this mistake now, right? My next question to you, again you will do a mistake, I guess. Again, I will write the formula. You know the formula. Prevalence is equal to incidence into duration. Everyone participate, huh? Everyone. You know the formula. My question is, what is the effect of immunization or vaccine? What is the, now just have a logical thought. What is the effect of vaccine? Vaccine or immunization on prevalence, and why? Whether the prevalence will increase on giving vaccine or whether the prevalence will decrease on giving vaccine. Vaccine देने से क्या होता है? You are vaccinated for DPT, you are vaccinated for OPV, Yes, you are vaccinated, yes or no? You are vaccinated for BCG. Yes, of course, we all are vaccinated for all these. Our parents got it vaccinated for all these diseases, all these infectious diseases. We all are vaccinated. So vaccine देने से क्या होता है? Once you are vaccination is a prevention. It is not treatment. It is a prevention. If you are vaccinated for some particular disease, yes, Rishinika, you are right. Yes, Kuldeep, you are also right. But tell the reason also. Yes, Rishinika told the reason also. So Iram, Kuldeep, what is the reason? So if you are giving the vaccine to a person, you are actually decreasing the chances of happening new cases. You will not have TB if you are vaccinated with BCG. You will not have diphtheria, pertussis and tetanus if you are vaccinated for DPT. You will not have polio if you are vaccinated for OPV, right? So actually, just a second, actually vaccination decreases the chances of new cases. So vaccination is not have no effect on duration. Vaccination have effect on incidence. So by giving vaccination, we are decreasing the incidence of the disease. So we are decreasing the prevalence. So answer is decrease. We cannot increase the prevalence by giving vaccination. We are decreasing. Yes, yes. So yes, Kuldeep, antibody form means what? Antibody form, so you will not have that disease. So you will never come in a new case. So incidence will be, just suppose everyone in India is vaccinated for all the infectious disease. So the new cases of TB will decrease. Now, if everyone is vaccinated for BCG, if everyone is vaccinated for OPV, there will be no case for OPV, polio, right? So we are not acting on duration, we are acting. So what is the summary? What is the summary? The summary is in front of you. Prevalence is equal to incidence into duration. Give me a thumbs up. What is the summary? Summary is that what is the effect of treatment on prevalence? What is the effect of vaccine or immunization on prevalence? I'm asking the effect on prevalence. So the answer is that, ma'am, treatment can increase the prevalence, can decrease the prevalence. Both can happen. Treatment works on duration. Treatment don't act on incidence. It works on duration. So the treatment which cure the disease, they decrease the duration. That's why decrease the prevalence, right? The treatment which do not cure but control the disease, they increase the duration of disease. That's why increase the prevalence. So treatment actually works on duration of disease, on duration. Prevalence is directly proportional to duration. If some treatment is decreasing the duration, prevalence is decreased. If some treatment increasing the duration, prevalence is increased, right? What about vaccine? Vaccine works on incidence. Vaccine actually works on incidence. So by giving vaccine, we are decreasing the chances of happening new cases. So vaccine decreases incidence, that's why decreasing prevalence. So the summary is that treatment can increase or decrease prevalence, but vaccine can always decrease the prevalence. Vaccine acts on incidence and treatment acts on duration. That is the summary. I cannot super simplify than that. I'm also a human. I cannot super simplify that. So give me a thumbs up if you got it. Everyone give me a thumbs up. So this the same thing is written in front of you. If new effective vaccine for any disease is there, incidence of that disease will decrease. So that's why prevalence will decrease. So it doesn't have action on duration. It has action on incidence. So I am done. I am done. Have you got it? Have you got it? Say yes or no. Say something. Yes or no. So you tell me there are few factors which increases prevalence. What is the formula? Prevalence is equal to incidence into duration. Just suppose in a city you are residing. The name of the city is X. You are residing in a city X. This is the map of X. This is the map of X. You are residing in X. So if diseased people are coming in your city and they are staying there, new diseased people are coming in your city and they are staying there. That is immigration of the diseased people in your city. Just suppose many new people are coming in your city via train, via water route, air route, and they are residing in your city. So of course the prevalence will increase because you are increasing the incidence, the new cases which is having disease. So prevalence will increase. The subtraction of the healthy people. If from your city, whether where you are residing, the healthy people are exiting out. Oh, why it is not working? The healthy people are exiting out. So it is the immigration of healthy people. So again, prevalence will decrease. Yes or no? So it is immigration of the diseased people and immigration. You know the difference of immigration and emigration. Yes, immigration means addition and emigration means subtraction. You know it now. So of healthy people. Yes. So ये दो reason तो समझ में आए सबको. Give me a thumbs up. Give me a thumbs up. Prolongation of life of chronic disease. Just suppose in your city many people have diabetes or many people have hypertension. So you will give treatment to all of them. So you are prolonging the life of diseased people on your city, in your city on the earth. You are prolonging the life. So you are increasing the duration of disease. ये दोनों तो incidence increase कर रहे थे, immigration and emigration. आप duration increase कर रहे हो by giving treatment, right? And decrease death rate among the disease, right? In your city, there are multiple super specialty best hospitals available, best doctors are available. So very less people are dying in your city because you have very decreased death rate in your city. So death rate come hai, so diseased people on this earth are staying more, right? So you are increasing the prevalence, right? So these are the 4 reasons by which we can increase the prevalence of any particular area. Maybe India, maybe a city, maybe anything. Give me a thumbs up. The opposite is of decreasing the prevalence. So if you do the immigration of healthy people and emigration of disease, that is the reverse of this, right? You are giving a treatment which is curing the disease, not controlling, curing the disease, and you are giving immunization. So that can decrease the prevalence. Give me a thumbs up. Give me a thumbs up. So prevalence can be increased by, decreased by. Instead of mugging up, understand the concept. Understand. So you can apply in your MCQ. Apply the concept in your MCQ instead of mugging up. Give me a thumbs up. Everyone give me a thumbs up. Now there are very good polls based on this formula. Incidence is equal to prevalence into duration. Are you interested in solving it? Yes, of course, you all are interested. So give me a break of 15 minutes. Give me a break of just 10 or 15 minutes. After 10 or 15 minutes, at 11 a.m. sharp, I will start the lecture again. Join another link of case control. I will not start case control. First, I will finish that. Then I will come on the studies. So first, I will finish the polls of incidence and prevalence. And then I will come on descriptive and case control study. So join the link of case control wala jo episode number 4 hai. वो गलती से 1 या 2 rename हो गया. So whatever link I have given in the WhatsApp and Telegram, please join that link, right? Just a second. Before that, there are few announcements for you. Just a second. Give me a minute. Okay. So thank you very much for being with me for this lecture. I really enjoyed teaching you. Hopefully same from your side also. Don't forget to write your feedback in the comment box. Please, it is very precious for me. It is very important. Next class is after 10 minutes. After 10 minutes means at 11 a.m. sharp. Please join me back and I will continue incidence prevalence ka polls and then I will start the hypothesis formation and the studies, right? Two important announcements for you. NEET PG 2022 All India mock test is going to happen on 26 Feb in the morning 9 a.m. Please everyone participate in this test because the pattern and questions are predictive of the main exam. So if you are targeting of NEET PG 2022, you should give this mock test. It is free and you can enroll anytime. For enrolling, you can use my code SACHDEV10. It is free to enroll and you all can participate. This is the first announcement. The second announcement it already happened. Okay. So please follow my profile link on Unacademy. Please go to NEET PG category on Unacademy Learners app. Install the Learners app. Go to NEET PG category and please search for my profile link Dr. Priyanka Sachdev. You will find my profile link below my name, right? Please follow it. You will get a list of my recorded lectures. You can unlock any recording using the code SACHDEV10. SACHDEV, Sachdev10 is the code, right? So see you all in the next class. You know there are 2 types of subscription on Academy. In plus, you will get only an Academy. In Iconic, along with an Academy, you will get Preparator also. So once you take the subscription, you will be eligible for all these batches, right? You can see the prices of all subscription here. For plus, this is the various plans. For Iconic, this is the various plans. Now the good news, the exciting news is that if you apply my code SACHDEV10, you will get maximum discount on all these plans. So anyone thinking of taking any subscription, you can apply my code. You can notice one more thing, longer the plan, cheaper it is. So if you're a first prof, second prof student, go with a longer plan. You can go with a 4-year, 3-year, 2-year plan. And if you want to give a trial for 3 months also. So better to go with Iconic. So thank you very much. I would like to see all of you in the next class after 10 minutes. And please be on time at 11 a.m. sharp. Bye-bye.